Time to go back to school, which means fall sports are right around the corner. Dr. Andrew McMarlin from Winning Health Sports Medicine joining us today with more on sports injuries and joint conditions in children. And is there a difference between sports injuries in children than there are in adults? I mean,
there absolutely are.
Yeah.
Well, children are not just small adults. I mean, their structures are significantly different. They have one of the big things that's different is having different growth plates. So you have the growth plates that are affecting your overall length of the bone, but then you have others that shape the contour of the bone. And so where you have these all these different tendons attaching, you can have these different injury where your muscles or tendons before your growth plates close are actually stronger than your growth plate. So sometimes things that look like it's a sprain or sound like it should be a sprain may actually be a fracture of a growth plate as opposed to a simple sprain of a ligament or tendon.
And a lot of times the adult will think, because of their way of thinking and they're not educated about it, well, it's just a little sprain on the child. And a lot of times they really don't realize they need to bring them to come and see you so that you can check it out and make sure everything's fine, because the injury could lead to something even worse if it's not attended to.
Absolutely. If you have a significant growth plate injury, you can actually affect the growth on that side of your body. If you have a growth plate injury in your ankle or knee, you don't want to let that go and have a additional injury where someone's leg is shorter on one side or the other. Absolutely.
Tell us about the difference between aches and pains with a child and an adult.
So in a child, there are a number of different things that conditions that are different. So partly because of these growth plates or false growth plates, you can have injuries that from sports, from sprinting or from gymnastics or football, where you can actually have an avulsion, like pulling off of a section of bone. So in a child, if your child is playing football or gymnastics or soccer, and they have low back pain for a week, that's not normal. So you have to make sure that they don't have a stress fracture of the bones in the low back or on the pelvis. So their bodies react very differently than ours do to some of these stresses.
Let's talk about, you were talking about football and gymnastics and so forth. At times there are concussions that occur with a child.
There are, absolutely.
How do you help a child recover from a concussion?
So one thing is recognizing that they have a concussion. So, and I think the education's getting better for coaches and parents, but there's in some sports, particularly football, there's still a stigma against, if they call it he had his bell rung or had just a ding. Because their central nervous systems are still forming, their brains react very differently and take longer to recover than adults do when you have an impact to the head. And I think all of us think kids recover faster from some fractures. Maybe they recover faster from some illnesses. That should happen also with injuries to the brain, but the opposite's true, because it's immature brain, immature nervous system, that it can take longer. And there are a number of different things that can be done to help kids get better faster, both back to school and back to play. It has to be respected that it's a significant injury, even if you can't see it.
Wow, those are really something to look at, especially, again, as you're saying, if you can't see the injury, there may be an injury there, and it's best to bring the child in. We're coming out of summer fairly soon, and we're going into fall. How can adults, parents talk with their children or to work with their children about these sports that are in the fall? So
anyone who's in a fall sport where their preseason training officially is starting in August really should be training now. I see a good number of kids, and I've treated a lot of people with adults as well, with heat injuries. And one of the things you have to train for is if you're doing a training camp in August, your body needs to be prepared for that for 4 weeks, 6 weeks ahead of time. So if you're in a fall sport, if your child's in a fall sport, they should be out running in the heat. Maybe not in the middle of the day, but they're ramping up the training now is really important, so they don't get a certain number of overuse injuries, but also heat injury. So it takes a while for your body to get used to that. It can get used to that. You can train it to acclimate to the heat and also to the volume, but it takes some time. So now it really is a time to start preparing.
It's kind of like going to basic training. You want to prepare yourself before you go there that first day, and it makes it a little bit easier.
Absolutely. And I used to set up training programs for guys in the kind of pre-SEAL and pre-pilot programs, where getting them ready for that type of training so they don't get injured the first couple weeks they're there.
Got a couple of seconds left. Where's your shop located, your office?
I'm on Houston Northcutt in Mount Pleasant, right across from the Cinnabar movie theater, and about a block and a half from Harris Teeter and Whole Foods.
And to a gentleman who stays fit and paddle boards to work every day. Appreciate you being with us, Doctor.
Good to see you again.
I like that. Now over to Aaron.